We are all here together to launch the next phase of the Massachusetts Health Information Highway. And I don't think that we can overemphasize how important this is to the delivery of healthcare as it should be. Not as it is now, but as it should be. Traditionally, we've provided healthcare in a very traditional way. Patients coming to us, receiving the care here, and leaving. But we know that to provide great care, we need to be able to provide care wherever patients are. We need to be able to provide information in a seamless fashion. And that's what all of this is about. I have said many times that I believe that Massachusetts is leading the way in healthcare delivery reform, and that is financial reform, that's in reform around the quality of care that we deliver, and that is also in healthcare IT. And this is an incredibly important component of that. I'm particularly pleased to welcome you here to the Carl Shapiro Simulation and Skills Center. This is a place of continuous learning. And it's here for our entire medical center and for our colleagues throughout the region and indeed throughout the world. It's really an essential component to improving the quality of care that we deliver. We share your deep commitment to healthcare reform and to the transformation of care that we deliver. And so we're delighted to participate in this moment. And now I want to turn it over to Secretary Polanowicz. Thank you again.
Thank you.
Yeah.
Thanks so much, Kevin. You and the entire BIDMC have just been incredible partners, really, from the beginning of the Health Information Exchange, the Health Information Network. We also talk about Health Information Exchange a lot lately, too. So certainly under Governor Deval Patrick's leadership, Massachusetts has been a national leader in healthcare reform. I think we all know that. From achieving near universal coverage to controlling costs and effectively implementing the Affordable Care Act, we have more residents with access to health care than any other state, and we know that that access is helping keep those families healthy. Today we're here to talk about building on that success by deploying a critical new electronic infrastructure that is a secure health information exchange. It's possible thanks to our partners in government, our partners in the provider community, and all of you, many of whom are working on the front lines to put these new innovations into action. I specifically want to thank Dr. John Halamka, who sits on my Health Information Technology Council, the team from Beth Israel Deaconess Medical Center, the Mass Health Information Technology Council members who are here today, thank you for being here, representatives from HIway, the Mass eHealth Institute, and the project team, my project team at EOHHS, for being a part of these efforts. Again, as Kevin did, I also want to thank our partners who are here from Atrius Health, from Holyoke Medical Center, and from Tufts for being here and being pioneers as we're deploying these next steps. I hope today will serve as a call to action for other organizations to join us, because I think what you will see today, you'll realize it can and will positively have impact on how we're providing health care. Before I end, I'd be remiss if I did not stop to thank the Obama administration for their direct financial support in funding these efforts. And now I would like to turn it over to our governor. This is a leader who has kept an incredibly sharp focus on healthcare access, controlling costs, and implementing the Affordable Care Act during his administration, more so than any other governor in America. And it shows in events like these. Our governor, Governor Deval Patrick.
Thank you very much. Thank you. Thank you very much, Mr. Secretary. So you were giving me the high sign to use the microphone, but not them? What's that? What? I was trying. Okay. If I speak up, is that better? All right. Do I have to hold it? No. Okay. All right, stage direction is complete now. Thank you very much, Mr. Secretary, for the warm welcome and for your leadership. Dr. Taub, thank you for your leadership and for having us here today, hosting us all. It's great to be with you on this day. John, it's great to be with you live. The last time we communicated, it was on a great big screen, me in Asia, and you, I think, in your living room.
I was in the farm.
You were in the farm.
Yeah.
And you were dressed at least from the waist up, which was a great thing. That's all we could. That's all we could tell. And I'm excited to be here. I am really the setup for the simulation we're about to experience in the learning facility across the way through that wall. And I have been assured there's no blood involved, which is another reason why I'm here. But I want to say that just over a year ago, we together marked the launch of the Massachusetts Health Information Exchange by sending a test transmission of my own medical records between Boston and Springfield. My medical records were sent securely. They traveled 88 miles in less than a second. Importantly, they were sent with my permission and in a secure, encrypted electronic package which no one was able to open except my own medical team. I think that was a way of demonstrating to many, many people who may be a little nervous about such sensitive information being transmitted wirelessly and through the network, that it can be done successfully. It has been done successfully, and the more we do it and do it successfully, the better healthcare will be. Mind you, that was just a demonstration, but that demonstration showed how quickly we can now respond when one of our citizens becomes sick or injured and needs coordinated care. And we all know that coordinated care leads to better care. In the past year, 55 healthcare organizations have gone live on HIway and have sent over 1.7 million transactions. We are well on our way to interconnecting the entire state. Now, this is all really great news, but we're Massachusetts, so we don't rest on our laurels. We want to take it all the way. We want to lead. We want to be out ahead of other states. We want to beat our own records, and we do want truly universal access to this information. We recognize that the lifeblood of our healthcare system is health information, and that our bold health reform efforts have to be supported by equally bold advancements in our information systems. So today, I am very pleased to announce our next advancement, to participate in this with all of you, and that's the launch of HIway Query and Retrieve. Query and Retrieve builds upon the current HIway and helps healthcare providers locate, request, and retrieve medical records from other providers serving a patient. This greatly improves the HIway by allowing a provider to quickly figure out who has information on a patient and then, with a click, request that information, again, furthering coordinated care, comprehensive whole person care. This technology is a win for all of us. It will help us save lives, reduce healthcare costs, and improve patient care all around. Now we're going to see a demonstration of Query and Retrieve by Dr. John Halamka. Atrius clinicians, I think, are involved as well, and clinicians here at BIDMC in the emergency department with communicating with clinicians on site at Holyoke and Tufts. Is that right?
That's correct.
Okay, let's hear it.
So good morning, and thanks very much for those introductory remarks. And as Kevin has said, sometimes in America, we actually don't have a healthcare system. We actually have a sick care system. That is, you come to a hospital or doctor's office in an episodic way, we treat you, and we send you to the next provider of care. But in the world of accountable care, in healthcare reform, we must have continuous wellness. We must have preventative medicine. If we're going to deliver safe, quality, efficient care, we must have an interconnected Commonwealth. So what we're going to show you today is the next phase of that interconnection. As the governor described, our first phase was pushing data from one doctor to another with patient consent. But what if you arrive at an emergency department? Your records are scattered at multiple hospitals, clinics, pharmacies, labs, and doctors' offices. You may not be able to inform the clinician of your medication list, your allergies, or your labs. How do we deliver safe, quality, appropriate care? Well, we are in the simulation center. We have an emergency department through that wall, fully outfitted. I did promise the governor that no blood would be involved. And so a patient has been brought to us by ambulance. He's 82 years old. He's confused. He's febrile. Dr. Kevin Ban, assisted by nursing staff Amelia Nelson, are now charged with evaluating that patient, delivering coordinated care, and doing so by respecting the patient and family preferences for care, of course, while also protecting confidentiality. I just want to tell you, we are going to be using live medical records today. The patients involved have fully consented for the release of that information, but I would like to ask the press not to do close-ups of that medical information, though consent has been given. The HIway, as you described, is secure, and data only flows when the patients allow us to flow over the HIway. So with that, I would like to ask Dr. Ban to escort the governor, Kevin Tabb, and John Polanowicz to the emergency department.
To scrub in.
Well, it's sterile. So right this way.
Governor, we're just going to go in and meet Mr. Green. We'll go to the other side of the gurney.
Good morning, Mr. Green.
Good morning, Governor.
Mr. Green, my name is Dr. Kevin Ban. I'm the physician who's going to be taking care of you this morning in the emergency department. What brought you in today?
Check your computers. Ask my wife.
Amelia, are there any family members here? Is Mr. Green's wife here?
The ambulance brought him in. He's been pretty confused. His heart rate's pretty high. His temperature is almost 102. And his blood pressure's a little low. He hasn't been able to tell me anything. He doesn't know his allergies. He doesn't know his medical history. He doesn't know what medications he takes on a regular basis. I don't have a whole lot of information.
Okay. In fact, I get the sense that he is confused. Do we have any information in our electronic medical record that'll help us understand what's going on with his medical history?
I looked in the BI records, and the only thing that I see is a bladder procedure that was done about a year ago. Okay. But again, nothing else. No allergies, no meds.
So, Governor, this is a difficult situation. He's got a high fever. His vital signs are concerning. What I'll do here is I'll throw a broad net, really, because there are a lot of different things, infection, but even problems with his brain, potentially in his abdomen, that could be causing these symptoms. I really don't know much about him. He can't give me any history, and his family's not here. Amelia, let's start with a head scan, no contrast. Let's get a chest X-ray, CT scan of the abdomen with IV contrast. I'm certainly concerned about an infection, so we're going to get some blood cultures up front. I want to give him broad-spectrum antibiotics and fluids right away. You mentioned a bladder procedure, could be urosepsis, so we'll do a mini sepsis workup and make sure that we get a urinalysis as well. Sir, I'm just going to examine you for 1 second. Take a deep breath. Deep breath. He looks awfully lethargic to me. Roncorous breath sounds.
Before we get too far, should we check the HIway and see if any of the other hospitals have any information?
Oh, that's a great idea. I think the likelihood is there are records out there, and if we could pull them, that would help us quite a bit. I'm concerned about his capacity, so I'll document into the electronic medical record that he doesn't have capacity and that we need this for medical necessity.
So what you've just seen is a typical emergency department scenario. The emergency physician, I am an emergency physician, has to guess, has to try to deliver care per protocol, has to try to respect patient preferences and ensure quality. But often there are silos of medical information. So if that changes, how does care improve? The Massachusetts HIway includes this portal. A physician is granted secure credentials. I will log in to that portal. Now, we were told by the nurse there are no patient family members. In fact, there's no contact information available, but we do have the patient's wallet. And so I will look up this live, real patient on the live, real production HIway. I enter the demographic information, and within less than a second, I find that the patient has been asked to consent in the past to disclose medical records at 4 different institutions. The patient has consented. Now, as you heard, Dr. Ban would have reconsented him even to view this information, but the patient today was not capable of granting consent. We see that there are 3 visits at Beth Israel Deaconess, 8 visits at Atrius, 1 visit to Tufts, and 1 visit to Holyoke. So let's take a look at the Beth Israel Deaconess information. The state does not store clinical information about patients. It is simply storing the fact that data exists at other healthcare institutions, doctors' offices, and hospitals, And from a secure authorized physician perspective, I have access rights to link on viewers or make requests of data from those institutions. So let's look at Beth Israel Deaconess. So as we heard from Amelia Nelson, there's actually very little data available on Mr. Green. Basically, we see no allergies, we see no problems, we see that there is a history of a transurethral resection of a bladder tumor, but very, very little to go on. This would be the point at which, in the emergency department, we'd stop. We would have to order the head CT, the MRI, the antibiotics, the multi-$1,000 workup because there was no other information available. Now, I said we actually have the ability to look at other institutions. So Atrius runs the EPIC system, a completely different system than Beth Israel Deaconess. I've clicked because I'm authorized. I now have pulled up the patient's EPIC primary care record, and Dr. Michael Lee will describe what's found there.
Thank you. So in this view, in our viewer, we're showing this gentleman's record as our clinicians would see it as well. So we open up to a snapshot view of his medical history. It gives a summary of medical problems, and because we're his primary care practice, there's a long history of medical issues that we've addressed, including for this person bladder cancer, an abdominal colon polyp, as well as hypertension, all significant issues that they were unaware of in the emergency room at the time. Of note, in our system, we don't have any allergies indicated for him, but we do have a list of medications that he's been prescribed from our practice. In addition, they could also go in further into a chart review mode where they could look at imaging, procedures done in the past, as well as encounters with individual providers that we have had with him in the past as well.
So we've gone beyond the silos of a single hospital and now reached real time with consent to disclose given into the primary care office record and have the benefit of the medication list, the laboratories, and the history that the patient has provided across 8 visits to Atrius. But we also saw that there was data available at Tufts and Holyoke. Now, Tufts and Holyoke have enabled an electronic system that allows me, the clinician, to electronically request the summary information on this patient be sent to Beth Israel Deaconess. So rather than phone, fax, email, I simply click a button. The medical record request is launched. Now we have Tufts and Holyoke joining us remotely. I'm going to go ahead and launch over the HIway this request. That request has now gone over the HIway. So Tufts, could you please introduce yourself and describe if that record request has arrived?
Hi, this is Phil Atrius. I work here at Tufts Medical Center, and yes, we've received your request.
Very good. Now, Holyoke also has a similar system in place. Holyoke is also joining us remotely. I'm now going to initiate an electronic medical record request over the HIway. That request is launched and has been sent. So, Holyoke, could you please introduce yourself as well, describe if that request has been received?
Hi, thank you. This is Becca Sweet, and I'm a clinical application analyst at Holyoke Medical Center. And this is Dr. Mark, medical director of our emergency department. We have received the request from Beth Israel. This patient has a consent on record, and we will be processing the request.
And it looks like we have a list of allergies and a comprehensive list of medications on this patient, which should definitely assist you in your care of the patient.
Well, thank you. And that's actually an important comment you've just heard. There are no allergies recorded at either Beth Israel Deaconess or Atrius, but there is an allergy history that could be very important to this case. Just logged in to the Beth Israel Deaconess electronic medical record. I will now go look up Mr. Green, and I see we have newly arrived summary information from Tufts and Holyoke. So let me click on that. And I see that we have a report of an MRI that has just been done of Mr. Green's abdomen. Remember, he had a history of bladder cancer and a colon polyp. Part of his confusion today could have been spread of cancer. There could be something very serious going on in his abdomen. And we might want to order several dangerous, expensive tests. So I know, Tufts, you're with us. Can you comment on this report?
Absolutely. This is an MRI of the abdomen area, and it actually shows no significant spread of the tumors in that area.
So we have a recent test that would have cost thousands of dollars and potentially caused harm that we no longer need to do. It has been retrieved from Tufts in seconds. Now also I have a summary from Holyoke. Now as I pull this up, as we heard, there are allergies and medications that we didn't know about. In fact, it lists the patient is allergic to penicillin and has a very serious life-threatening reaction to shellfish. Now you say shellfish. Why is that important? The actual reaction is to iodine, the same material we use when we do IV contrast x-rays. And you heard Dr. Ban about to do an IV contrast x-ray of this patient, which could have caused him very significant harm. Holyoke, I know you're with us. Can you comment on this record?
Well, we're glad to have been able to assist you and in the care of the patient in terms of being able to provide allergies and medication list.
So thank you. Now, I'd like to turn it back to Dr. Ban because we are back in the emergency department, and with the information from Beth Israel Deaconess combined with Atrius, combined with Tufts, and combined with Holyoke, the nature of this patient's care will be done quite differently. Dr. Ban.
So, Governor, with that information, I'll modify my approach significantly. Amelia, first of all, has a great idea to access that information. I want to change that order list. No need for a CT scan of the abdomen because we've got the MRI that shows really there's nothing going on. And we can avoid that potential IV contrast allergy, which could have made Mr. Green even worse. I was planning to give broad-spectrum antibiotics with penicillin-based drugs. We're going to avoid that. Let's go with vancomycin and cefepime because of his history of cancer. More importantly, let's focus on really what's going on here. And I think this is likely to be sepsis. Let's just do a mini sepsis workup and let's get Mr. Green treated quickly. Sir, we've gotten information through the system about your past medical history. We're going to guide your therapy. We're going to take good care of you today, and we're going to get you through this.
Okay. Thank you, Tom.
My
we'll
pleasure.
Be sure to update your medical record here, and we'll get in contact with your family, okay?
Okay.
Well, thank you. And I would like to ask Dr. Ban and Amelia Nelson, the governor, John Polanowicz, and Dr. Michael Lee to join us for a debrief of what we've seen today. Now, the governor knows that I've been very passionate about this kind of healthcare information exchange. And if you actually, for those of you who may have seen my blog, you know that my father died 10 months ago. My mother broke her hip a year ago, and my wife was diagnosed with breast cancer 2 years ago. And all experienced completely uncoordinated care, with my wife taking pieces of paper from institution to institution. And as my father was dying in an ICU, I was carrying paper-based advance directives from doctor to doctor. Now we're going to hear from all of our stakeholders about their reaction to what they've seen today. It is my sincere hope that my 20-year-old daughter will never experience lack of coordination of care, issues of quality, and issues of safety in her medical lifetime, because the new IT tools we have available break down the data silos of the past. So first, let us turn to Dr. Ban. As an emergency physician, as I said, you often fly blind.
John, as you know, this is a scenario that we'll run into every day in the emergency department here at Beth Israel, much less across the Commonwealth. You find yourself in a situation where you have to care for a patient who really quickly needs intervention, and yet you don't have any information. As you saw in this scenario, I was able to modify my initial approach, which was to throw a broad net, and really focus care down to what was happening with Mr. Green and what he needed. That's a big difference in the emergency department, and one that is going to improve care without any question.
And so what we have heard is that we avoided unnecessary testing, we reduced cost, improved quality, and importantly, delivered timely care, patient-centric care to Mr. Green. Now, Amelia, as a nurse, you are responsible for the safety and the quality of the care delivered in the emergency department. Now, what was your reaction to having that new information as you were about to carry out the orders that Dr. Ban had initially given?
This is a huge opportunity for us to have a plethora of information on a patient. You know, care shouldn't start in the ER. It starts with a primary care doctor and should continue through the whole time that they're in the hospital. We shouldn't be repeating tests that are unnecessary, and it really allows us to customize the care to the patient and allows us to be sure that we're really monitoring their safety, knowing their allergies, and knowing the tests that they've already had.
And we have our colleagues from Atrius, Tufts, and Holyoke. So, Michael Lee, from a primary care perspective, describe how the coordination between the emergency department and the primary care office is improved by the HIway.
Well, this is so important for us because as we see our patients move not only from our offices into emergency rooms but also to other clinical settings around our community, it's really important for us to have access to information from multiple sites. This ability to retrieve information from multiple areas is vitally important. It will also be really important for patients as we start to include information about their care preferences, to be able to include those so that all caregivers are aware of what the patient chooses for their future as well.
And that's a very important comment because, as I mentioned, every one of us as patients may have different care preferences. In the case of my father's death 10 months ago, he did not want to be resuscitated. He did not want chest compressions. He did not want life-sustaining measures. But yet that was recorded in a system not accessible in the ICU. And so if we're going to respect patient preferences, one of our harms in medicine is delivering unwanted care. And with primary care, emergency department coordination, we now deliver safe, quality, timely, patient-centric care. Now, Phil, I know you are managing many IT systems at Tufts, and can you comment on the ability to have this secure mechanism available for the transmission of records from Tufts to other institutions?
Absolutely, Dr. Halamka. We're very, very excited to be a part of the Mass HIway, to increase our connectivity with our colleagues here in Boston and across Massachusetts. And we're looking forward to that increased level of connectivity being able to impact patient care positively, very positively.
And Holyoke, you are located in the western part of the state. It's so critically important that we deliver care across all geographic boundaries. So can you comment on the importance of having this capacity to pull records from anywhere in the Commonwealth to coordinate care?
Sure, yes. At Holyoke, we're also really excited to take part in this initiative, which will allow us to access medical records across the state. And it will definitely help us to avoid duplication of diagnostic testing, and it will enhance patient safety.
Well, thank you. And I want to emphasize what you've seen here. 4 different organizations with 4 different medical record systems linked together with a common infrastructure driven by patient consent and backed by a very secure cloud-hosted software system. Now, John Polanowicz, as the Secretary of Health and Human Services, you are charged with delivering safe, quality care to the maximum number of citizens in the Commonwealth using our resources most wisely. And could you comment on how the HIway can empower you to do your job better?
Sure, John. First, again, thank you all for being here and seeing what really is a glimpse of the future of where we're going and how systems like this can support what we're trying to do, whether it be under the Affordable Care Act or continuing to expand access here in the Commonwealth. I think what you saw here today certainly helps us use the dollars that we have in the highest and best fashion. You know, not only we can have a whole other conversation about the patient safety aspects that you saw in the case here today, but the cost of duplicative testing, and I think all of us who are either in provider organizations or came from provider organizations know how many times the information that the clinical team got just in terms of a problem list, in terms of an allergy list, in terms of a med list, in terms of what the last visit was, what a huge difference that makes in terms of what is going to be the kinds of testing that's done. And we all know the testing is incredibly expensive, and we know that that's a piece of the waste that's out there. So we think that this is a tremendous tool, and we're very anxious to have even more providers sign up to use this data so that the kinds of things that you see today, more providers have access to that information. It only works better as we become more and more robust with the data that's out there.
And Governor Patrick, of course, wanted to leave the last word to you. So you saw this clinical scenario, no blood. And so how did you feel about the differences in an emergency department encounter empowered with this information sharing we've now enabled for the Commonwealth?
Well, this is the first time I've seen this system in use. I've had it described to me. I was struck by the fact that so much really vital and useful information was gathered in 10 minutes, and that was with interruptions for explanation. So if you take out the explanation and you think about it in real time, we were talking about this on the way in, it's 4 or 5 minutes to avoid a whole lot of unnecessary cost, and indeed in this case, in this scenario, possibly to have saved a life or at least compromised the patient's health. So enormously important. And I think that's apparent to all of you, certainly those of you who understand the medical system more intimately than I do. I'm looking ahead, of course. So I want to see what it takes to scale to every facility, both the well-established hospitals like those that have participated and other facilities where people get their medical care, certainly in Massachusetts, but then being mindful, we all move more and more in this country and in this world more broadly than our state boundaries, our community boundaries. So how we think about scaling over time and doing that in a sensible but a deliberate way. And then secondly, what do we learn as we go? Because the secret of any great system is constant improvement. We were talking about what happens in the event you don't have the patient's wallet on hand. In an emergency, that has to happen from time to time, where you don't have identifying information. I think you were saying, Doctor, that you have to designate you have to express your willingness to have your records made available on the system?
Yeah, if a patient has capacity, you want them to be able to do that. In a situation like this one, where he was confused, at that point, medical necessity would dictate that I would be able to move ahead even without consent.
That may answer that question. But so I think I guess my point here is, let's hurry up and scale it, but let's do it wisely and thoughtfully, and continue to think about how we make the system more successful, more vital as we go along.
Well, excellent comments, and let me just amplify that. Our state laws in Massachusetts require opt-in consent to disclose. We've been very patient-centric and very conservative with HIway. No data goes into that index of patients until patients consent to put it there. Now that means today we are launching this service. So there are some patients already who have consented, but today's the first day. And so we will be, as you suggest, going beyond our 57 current participating institutions to all the doctors' offices and hospitals of the Commonwealth, and we will be seeking consent. So tomorrow, when you go to an emergency department, every byte of data in every encounter will not be so seamlessly available, but it is our hope as we work diligently over the next year and gather more patient consent and more participation that we will have this seamless interconnected network of every record.
John, is it necessary for patients to take some responsibility here in terms of expressing their consent in advance? Is there something I should be doing with my primary care physician to say, whatever it is, let it go when the time comes?
So as the participating institutions register or schedule patients, they will be asking for the consent to send that registration event to this central state database so that we know where your records are. And remember, you have absolutely total control. That if there are institutions or visits that you would much rather not have shared, that is completely under the control of the patient. So yes, the patient's responsibility will be, when presented the form that says, we wish to coordinate your care, and you must opt in, if you wish coordinated care, up to you, sign here or not. That is your responsibility and your decision. And so what I hope you've seen today is we've taken the HIway beyond just pushing one record with a patient and doctor's consent to another institution, to one in which, in real time, multiple records can be retrieved from multiple institutions with security and consent. It's a very different kind of problem to solve. In fact, a much harder problem to solve. It has required the diligent work of many people, payers, providers, EOHHS, technologists, and vendors to make this happen. It has truly taken a community. And what I think we've heard from both the Secretary of EOHHS and Governor Patrick is Massachusetts is a pretty unique place. I can tell you, I traveled the United States, and to find organizations that work as well together as we do, government, industry, and academia, is rare. To find payers and providers that respect each other, and to find providers that believe that information exchange raises the tides for all boats. Sounds obvious? It's actually rare. So as you've said, there is a scalability question. We have New Hampshire, we have Connecticut, we have New York. We are surrounded by states, and patients do travel across state boundaries. We have built everything you've seen today on national standards. There is nothing Massachusetts specific about what we've done. So we are well poised to connect to other states across the country as infrastructures evolve. As is often the case in Massachusetts, we just happen to be first. So with that, I would like to turn it over to Manu Tandon. And Manu Tandon is the CIO of EOHHS, and he is going to offer some concluding remarks as well as to coordinate our certificate ceremony. Thank you. Manu.
Thank you, John. I guess now that I can breathe again. Projects like these never happen in isolation, and I could stand here for hours thanking everybody who has played a critical role in this. But let me just first thank you, Governor. Thank you, really, for coming. It means a lot to the project team and to everybody. And Secretary Polanowicz, thank you very much for your ongoing support. Members of the HID Council who are here, thank you so much for your monthly guidance and support to get us where we are. Medicaid organization leaders here and our federal partners at CMS. Without you, we couldn't have done it. You provide the funding. You have made Massachusetts unique in that we are the first state in the nation to fund the statewide HIE using Medicaid funding, which provides us a leg up as far as sustainability is concerned. I'd also like to thank you, Dr. John Halamka. I'm not sure where he, oh, right there. Without your guidance, this wouldn't have been possible. BIDMC, the Simulation Center, thank you for tolerating us. Thank you for answering every little question that we had. Thank you for bearing with us for the 7th time this morning when we did our simulation. I'd also like to thank all our partners, MIHI, Orion Health, MIHEC. Without you, this wouldn't be possible. And I'd finally like to thank you all for coming. I think it's a great way to start out a new year, and I'm glad that it went well. One quick word, I think this HIE is, to me, a cornerstone technology as far as our mission for reform to enhance quality and reduce costs in the healthcare system is concerned. I think what you saw today was a glimpse of the future, a future that probably the next generation will just take for granted. But there's work left to be done. There's work left to be done. We need to work diligently and tirelessly with all the providers, big and small healthcare organizations in the state, to get them on the highway, to get them in this relationship listing service registry that you saw today, so that we can build the records of everybody in there, so that when people go to emergency departments and look up for records, they get something in there. I personally and my entire team and our partners stand ready to take on this challenge and welcome your participation in the future in 2014 and beyond. And I hope that we can share similar good milestones with you as we go along. At this point, I'd like to request Governor Patrick to honor our participants today with an official citation and thanks. There will be a brief pause for pictures with each. And I'd also like to actually request the EOHHS and our partner organization project teams to please assemble for a picture with the governor. The program will conclude with the picture with the project team. And I, again, want to sincerely thank you for being here. So, Governor Patrick, if you could please join us. Let me just walk over to you. So first off, It is like graduation, except I'm usually on the other side. Dr. Michael Lee from Atrius, that you heard from, he's the Director of Clinical Informatics. Dr. Kevin Tabb, CEO, BIDMC, thank you for hosting us.
Right here. 1, 2, 3. You've done this before, haven't you?
A few times.
If we could get Skype-fed Carl Cameron, VP of Operations and CIO of Holyoke Medical Center, via Skype. We'll get you the citation. Thank you. Thank you, Carl. And Bill Chikolovich, Vice President and CIO, Information Services at Tufts Medical Center. Thank you again.
Thank you, Governor. Appreciate your support.
Appreciate you.
Thanks, Bill. Look right here. Okay, 1, 2, 3. Thank you.
Thank you.